Thanks a lot. It's really great that so many people have come. I think about 120 or 30 at the last look. I want to give a very quick overview, and it's going to be superficial in 15 minutes, of Scotland's Plant Health Centre and what we've been doing since we last met last March 2020. The last time we all met, or many of us met, was at the Scotland's Plant Health Conference on the 12th of March. It was so nice to actually have everybody speaking face to face together, and seeing these pictures really makes me realise how much we all missed that personal contact. And it was a really great meeting. I think about 5 days after this conference, where already none of us were shaking hands, 5 days later, we went into lockdown, and we were told that lockdown might last up to 2 weeks. And of course, 15 months later, we're still there. So one day, I really hope that we'll get back to face-to-face meetings, and I look forward to the day that happens. But even though we've been in lockdown, we've still tried, in terms of the centre, to have business as usual. We've kept our activities going. We've been meeting every 2 weeks, the centre staff, virtually, to make sure things keep moving. And we meet Jerry, the Chief Plant Health Officer for Scotland, about every month. And we've continued to commission projects and to publish. One example of the type of stuff we were publishing last year in the early days of lockdown was a policy summary and report on key and emerging implications of COVID-19 for plant health in Scotland. So plant health and COVID are definitely a related topic, and it's important to know how plant health might be affected. And if you want to see that report, you can go onto the website and have a look. So during the last year, we've published 10 projects and we've commissioned 7 new ones. And I really don't have time to go into all these different projects, but I just want to give you a feeling for what's been done. So first of all, we published a project on climate change modelling, such that we can put any new pest and pathogen into the climate model and see how its introduction and spread might be affected by climate change. We've published 2 projects on the impacts of pesticides, 2 related projects. Actually, it was really about the negative impacts of pesticide on agriculture. What we didn't really take into account, and the reports weren't supposed to be on that, were the positive aspects of losing pesticides in terms of biodiversity, etc. So this is something we're likely to be addressing this year. We've published 2 projects on potato cyst nematode, which is a problem for the potato industry in Scotland. The first project led to discussion amongst stakeholders, which eventually led to a working group that the Plant Health Centre were involved in bringing together. And so the second report was a report on that working group. And then we've also published on the brown marmorated stinkbug, which is a problem already in the south of England and in the rest of Europe. And we've been looking at the likelihood of it establishing in Scotland. We've done work on emerald ash borer. Again, the likelihood of it being able to establish in our climate, but also looking at models that we used for emerald ash borer that could be used for other pests. We've moved the Scottish Integrated Pest Management Assessment Plan from the Scottish Government website to our website. We've improved it, and we've split arable and grassland agriculture to make it easier to fill in the forms, and people are now starting to use the assessment plan on our website, which we're very pleased about. And then 2 years ago, we produced online plant health resources that we called a knowledge bank for the natural environment, because we felt there was less available for the natural environment than there were for other sectors. But what we've done now, because of the success of that, we've added information of the other sectors. So now the natural environment, forestry, agriculture and horticulture are all covered in this knowledge bank. And so if you do want some information on plant health, or you're just wondering where to go or what to do, it's worth a look to get some ideas. And so this is just a selection, but there are lots of different projects and summaries that you can go and look at on our website, and we really encourage you to do so. And then finally, on the stuff we've published, we published our key principles. These are now available on the website. People that came to the conference last year might remember that we had a workshop to look at these principles, and based on our discussions with you, we completed these. You can see on the left that we have our 5 key principles, and then we've got more detail in a PDF document on the right, which you can go to and look at on our website. The idea being that if you're a seller of plants or a buyer of plants or anything else to do with plant health, you can look at these principles to give you some ideas of how to go about considering plant health in the work that you're doing. And then we've commissioned 7 new projects. The first one looking at alder health in Scotland, one on the threat from bronze birch borer. We have another potato cyst nematode project. So I said the first one was a Plant Health Centre Commission project. The second one was a working group report. And this third one is actually acting on the working group, information that came out of the working group. And then we've already had 3 Xylella fastidiosa projects and published them. And this is a 4th one, which I'll talk briefly about later. We have a new fellowship working for a year part-time with Nature Scott. This is a plant health expert in that area that wants to work with Nature Scott to really identify the key factors in plant health that the natural environment should be or could be working towards. And the great thing about this is that the people within Nature Scott are going to be working with other people in the natural environment, and this expert can really work together to try and prize this apart and identify the key factors. We also have a project on farmer and agronomist perceptions on the risk of pests and diseases. And then partly because of lockdown and the new ways that we're trying to communicate, we have a project looking at how the Plant Health Centre can enhance its communication. In September last year, there was a UK Plant Health Week where we launched the key principles. And we also wrote 4 blogs which were trying to bring the key principles to life. We had one on whiskey and gin, one on sudden larch death, one on protecting our humble spud, and one taking steps for healthy forests and in Scotland. And not surprisingly, they all got some media attention, but not surprisingly, the one on alcohol got the most attention, and we had over 300 media hits, media items, things like the BBC Scotland, the Times, the Daily Mail, etc. And so it just shows that this is really important, and we are able to get out mainly to the public as well as the sectors online today, sorry, the stakeholders online today, to get over the importance of plant health for all. And then there's actually been a second Plant Health Week, one this year, which this year's fallen in April. And at that, we've had a number of blogs and videos looking at ethical considerations for using diagnostics in plant health, which I'll touch on later. Strategies to tackle the grain threat from PCN, that goes back to the working group. The role of plants in zoonoses, a really important role that not everybody thinks about, and that is the role that plants play in spreading zoonotic pathogens such as E. coli and Salmonella, Shigella, etc. And then a day in the life of a crop clinic. You may remember that we've spoken about before, and we will have these colleagues online today. This is the SART team, the Science Advisory and Response team, They're experts in different aspects of plant health from a number of different organisations that we can call on for expertise in specific areas, but that we also often get together to talk about a certain issue and get lots of different perspectives on it. And to that end, we've held a number of workshops. And as an example, we've had in December a workshop on modern methods of detection and the ethics, modern methods and ethics of pest and pathogen detection. And I talked about that as being one of the topics that we covered in Plant Health Week. We have another one next week on emergency response planning and war games. And then tomorrow we have a workshop together on enhancing communication for the Plant Health Centre. So these are very valuable to us. I showed this slide last time to say that one thing that the Plant Health Centre does or tries to do is to build up teams of people that we can call on in the future. And this is our Xylella team. Last time, all these people met with 3 separate projects that we published recently. And based on the outcomes of those projects and the shared information within them, we've just commissioned a new project where actually all these guys are acting as a team together. And we've had several meetings with them now. And it's really fantastic how this team's come together and the work that we're able to do together because of it. And just to show you one more example of a knowledge network, and this is the biosecurity team, the 3 projects that Mariella and colleagues are going to talk about after me. And you can see there are 17 different participants here. I've just noticed I've spelt Bergling's name wrong, and I apologize, Berglings. It should be Karlsdotter. There are 17 people involved in this from 8 different organizations. And it's a really fantastic way of bringing all these experts together to help us with a common cause. We also meet other important groups and agencies outside of the Plant Health Centre. For example, the UK Science Partnership for Animal and Plant Health. It's got the UK government. It's got the different devolved governments. It's got Nicholas Spence, who's the DEFRA's Chief Plant Health Officer. It's got the Animal and Plant Health Agency, APHA. It's got many of the big funders like BBSRC. The idea of this particular partnership is to come together to try to ensure that things concerning animal and plant health are done together by all these different organizations, and ideally that different funders get together to fund things together so that we can make sure that we get the most out of certain areas. And we're also interacting with, and actually some of us are involved in projects on the Bacterial Plant Diseases Initiative, and this is an £18 million project. You might remember Bridget, the Xylella project was the first one to be launched. We meet these people regularly. This is a group of projects, I think there are 9 in all, that specifically target bacterial diseases that are of importance to the UK. In terms of impact, just 3 examples I'll give you today. The first one is the potato cyst working group, potato cyst nematode working group. We were asked by Scottish Government to form this working group to try to identify what needed to be done to control this pest in Scotland. We had a working group of over 50 people from academia, industry and government to identify the issues, and we wrote a report that we submitted to Scottish Government in November and published soon afterwards. And we had very positive feedback from the minister of the time, which was to try to fulfill what we'd suggested needed to be done to try to make this issue better. The second example is the Ministerial Pesticide Workshop. The Plant Health Centre produced 2 pesticide reports, and these formed the large part or the basis for a Ministerial Pesticide Workshop that took place on the 19th of March this year. And I believe there's going to be a follow-up workshop. So the reports have been very useful in that. And a third example is the Xylella contingency plan. The Scottish one largely follows the DEFRA plan, but the 3 Xylella reports that have been produced already, and hopefully the 4th that's due to follow shortly, has been able to add new information that is specific to Scotland, that should be able to help Scotland strengthen its plan specifically. We work with other centres, the Centre for Water, CREW, Centre for Climate Change, Climate Exchange, EPIC, the Animal Disease Outbreak Centre, and Safari, the KE Centre. And what we're doing at the moment, we've submitted a joint bid to COP26 to highlight some of the work we're doing. This is the green zone where the general public goes. So we hope to hear soon about whether we'll have some sort of exhibition in that. As well as all the reports we've produced, we've also been writing reports for the Scottish Government, and we've just completed our annual report to them. Some of you will know that we had newsletters to get our information out. We decided they were coming out too infrequently, so we've changed our format to bulletins, which you get by email, and they come out much more often, and we hope that you're enjoying reading those. And if you don't yet have access to them, you can go to our website and sign up for them. And then finally, we have our website and Twitter. Our website has about 13,000 users at the moment, which is double what it had last year, which we're really pleased about. And what we'd really like to do is to hear from you all about how we could make our website more useful to you. So if you have any ideas, if you go and have a look at the website and you have any ideas on that, please get in touch with us and I'll give you details on the next slide. We also have a Twitter account. The number of followers, again, have almost doubled in the last year. So it really shows that the website and Twitter are helping in some way to get our information over and to share information. So for further information on Jerry and the Chief Plant Health Officer for Scotland, you can go to this website in blue and you can follow him on Twitter at Plant Health Scot. And for the Plant Health Centre, you can go to our website, which is here in blue, and you can contact us directly on info@planthealthcentre.scot, and you can follow us on Twitter at Plant Health Scot. And thank you very much for your time.